By now, you've heard about asymptomatic carriers, people who have COVID-19, but they don't show symptoms. Well, the World Health Organization made a very surprising announcement. They said that catching the coronavirus from someone with no symptoms is rare. Meanwhile, Texas is dealing with a record number of hospitalized coronavirus patients after the state reopened early. Of course, we have our expert, Dr. Payal Kohli. She joins us live. Ooh, black and white. I love it. Classic. She's here to help make sense of it all. Doc, it seems like we're getting conflicting messages. So the World Health Organization is now walking back some of those claims. So how did they get to this conclusion in the first place?
So, Tori, this was based on data from contact tracing coming out of Taiwan and Germany and 2 to 3 small studies. And what they said yesterday was that asymptomatic transmission is likely very rare. And actually, today, they retracted that completely and said that it was a misunderstanding and that they regret saying it. And I think this was really sloppy on the part of the World Health Organization to overinterpret the science like this and make this kind of a misstatement, because all it did was confuse people, which it clearly has, and it really was not reflected in the science. So if you think about it, contact tracing is a very imperfect science. It's actually based on people's memories and recollection of what they've done, where they've been, and what kind of symptoms they've had. So if you ask a person in a nursing home who has dementia and is elderly what their symptoms have been and who they've been in contact with, you can imagine that's very difficult. And it would even be difficult for people like you and me to ask me what I felt 2 weeks ago, whether I had a headache or a stuffy nose. So all of this data is very imperfect. And to make this conclusion based on this limited data, I think was really a misstep on the part of the World Health Organization.
Wow. Interesting.
So what do you think our takeaway should be from getting confusing messaging?
Like this, yeah.
Yeah, so let's talk about that a little bit, about whether or not asymptomatic spread is possible, because the takeaway remains the same. Asymptomatic spread, and all the science supports this, is occurring, and it's likely occurring at a pretty high level. And in fact, in their retraction today, the World Health Organization said that it can be occurring in up to 40% of people, which is really very consistent with what the CDC and Dr. Fauci have been saying all along. So now that the World Health Organization has retracted the message, it's all very consistent. But the messaging to everyone should be that people can and are spreading this virus even before they have symptoms, or some of them may never go on to have symptoms. So when you go out into the community, you have to assume the same thing we've been talking about, you guys, that everyone could potentially be infected with the virus and they just don't know it. So you have to wear those masks. You have to do that social distancing. Now, one thing we realized from some of this World Health Organization data is that the people that we previously thought were asymptomatic may actually be minimally symptomatic, but you just have to provoke those symptoms. So if I asked you, Tori and Erica, today, have you guys had any symptoms in the last 2 weeks, you might say no. But if I specifically sat down and said, have you had a tiny headache? Have you had a stuffy throat? Have you had, any other mild symptoms, body aches or fatigue? It might jog your memory. And so that's what they're finding, is that a lot of people who initially said they had no symptoms at all, when probed about specific symptoms, actually reported that they may have had mild symptoms.
Oh, that's so interesting. Do you think people aren't also being forthcoming with contact tracing because of a stigma, right? Of like, A, who they were with, or B, because it might look weird or bad for them. How do you feel about that?
No, I think that's an excellent point, because I think mainly what we've been doing with contact tracing here in the United States is asking people, and not using things like GPS technology, closed circuit cameras, credit card receipts, which they've all done in South Korea, which actually shows us that the difference between what people recollect or what they admit to, Tori, to your point, is very different from what they may actually be doing. And so to really get contact tracing accurately, you have to have those ancillary pieces of information to really put that together, because people may not admit or they may not recall what they've been doing.
Yeah, that's interesting. Any questions for you?
No, I did interview someone for my podcast, and that's what she said, that she got COVID. She did everything, quarantined, got through the whole process, and she just didn't tell anyone, aside from the people that she was with on the day that, she got infected by, because of the stigma.
We've got to release that. Thank you for all your information. You always make all of us a little bit smarter, and that makes us more powerful. We will see you tomorrow, Doc. And everyone says you look good in salt and pepper. So if you have a question about coronavirus you want answered by Dr. Kohli, write us on social media. You can also email info@dailyblastlive.com. There's no panic, just prevention and precautions. We'll do a little Cuomo.